Cayman's community station. This is Bobo FM. The views and opinions expressed by the following program and its participants are solely their own opinions and do not represent the opinions of DMS Broadcasting and have no affiliation to the BBC.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA's Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Welcome back to another episode of Healthcare Today with the HSA. I'm your host, Chuck Taylor. Each and every Friday and Saturday, we get together and talk about all things related to your health. And in this one, we like to bring this home. We are talking to a plethora of people here this morning. And just go ahead and introduce yourselves to our listening public.
Hi, I'm Claire. I'm one of the midwives that works on maternity ward within HSA.
Hello, my name is Leroy Campbell. I'm one of the obstetrician gynecologists that work at the HSA.
Good morning, I'm Rob Bomont and I'm the Neonatologist at HSA.
Hello, I'm Angela and I'm one of the neonatal nurses working in the neonatal unit at HSA.
I'm Alicia, working in the Women's Health Department at HSA, one of the midwives.
So with that being said, it's no surprise we're talking about everything dealing with maternity and is it neonatal?
That's right.
Neonatal. So no surprise there. And I just want to dive into it. It's been, I want to say, an upswing in me seeing a lot of purchasing baby stuff and moving around since the pandemic. Has things kind of gotten back to normal with the maternity and things of that nature?
Definitely. We didn't see any drop in anything at all during the pandemic. If anything, our numbers have increased during the pandemic. And since then, we've more births.
Exactly. And that means that there's the services must be expanding because it has been one of those situations where I see a new generation before it was very kind of stagnant when it comes to maternity. You stayed at home, you wasn't working so much. How has lifestyle changed to go and coincide with maternity?
I would say that we have a variety of like different people on island, lots of different workers, people who are coming in and out, with the workflow. So we have women who are working full-time, part-time, some who are stay-at-home, and across all ages, from 18 right up to 40s, having their babies. So it's over the last few years, many more people having babies.
Okay, let me just kind of switch gears and talk to Dr. Campbell about this. The range of maternity services offered at the HSA, I would say I've seen a growth with the HSA over the years, so I'm sure that this has been trending even in your department. Tell me a little bit about that.
Yeah, definitely. The island is growing at a rapid rate, 10% per annum. The population is increasing, and naturally that's going to translate into more births, more patients. And one of the things the HSA has been doing a good job of in the last couple of years is increasing capacity, both in terms of technical expertise as well as in terms of the resources for managing the patients that we're seeing. When we talk about maternity services, we can separate them into services that exist prior to delivery, what we call antepartum or antenatal care, and services that occur during the delivery process, what we call intrapartum care, that's the medical terminology. And then, of course, we have care after, which is postpartum care, which on our side, it's maternal. And then we have our neonatal staff here who deals with the baby. So if we were to look at the antepartum care, we have a plethora of resources. Firstly, we have our clinics, in which we have a combined service where we have both obstetrician gynecologists working alongside very experienced midwives. And so our patients benefit from those expertise. They initially at booking have a comprehensive assessment that allows us to identify risks, because that's what obstetrics is about.
You really offer a very personalized service from the initial consultation that I'm hearing, that you really take a look at each individual person, their needs, and assess that and build according to that.
Yeah, obstetrics is really not very complicated, to be honest, Chuck. It's really about identifying risk and putting measures in place to mitigate risk. That's what we do. And of course, each patient's situation is going to be unique. And so in seeing them, that allows for that. We also have we also provide educational services. So one of the things that I find very exciting is that we have what we call ParentCraft Classes, where parents, not just the mother, but also dad as well, and even their support system can come in to be educated on what to expect during the process of pregnancy, during the process of labor and delivery, and afterwards. We also have, over the last year or so, implemented what we call multidisciplinary meetings. We have a multidisciplinary committee. And what that means is that if you think about obstetric care, you're going to have women coming in who may have hypertension, who may have diabetes, who may have heart disease, who also are pregnant.
Wow.
And so what you realize is that if they're going to get comprehensive care, you're going to have to bring together specialists that have all the different expertise. It's not just the obstetrician. And so that's one of the initiatives that I'm particularly excited about, When we get into the intrapartum care, meaning doing labor and delivery, we have amazing midwives. We have Claire here, one of my favorite midwives. No, I don't want anybody to get jealous, but she's amazing. We have an amazing team there. Women, even when it comes to pain management, we have our anesthetic team that can ensure.
It sounds, don't take this wrong, it's simple. You just have a baby, but it's not that simple. It's a very complicated process, ensuring the mother, the child, and even the extended family is well involved and well taken care of with information.
Absolutely. It's not, and no, especially nowadays, it's not as simple as it used to be, because what you're finding is that many women are putting off childbirth to later years. And so you're having higher risk pregnancies on a whole, because as we get older, we're at increased risk of developing chronic illnesses. And then you add to that the fact that we do have generally, not just here in the Cayman Islands, but all over the world, an increase in rates of chronic illnesses, hypertension, diabetes, obesity. All these things are on the rise.
That's become a norm almost.
Absolutely. So, it's very important that care is provided in that comprehensive setting. And I'm pleased to say that, to be a part of a team that is able to supply that to the women of the Cayman Islands.
I wanted to ask, since I have you, the importance, you brought up education, prenatal education. How soon should a couple start talking and having that? Say, okay, you know what? We're going to have a child this year. You get pregnant. How soon should we start thinking and talking about that, from nutrition? Give me a little insight on that.
No, you're a quite smart guy, Chuck, based on that question, simply because you're indicating the fact that the conversation doesn't start when you get pregnant, it starts before. Mm-hmm. And that's really when it needs to start, is when you're planning. The ideal pregnancy is a planned pregnancy, a pregnancy that identifies what the risk factors are before the woman gets pregnant, and then we begin to optimize her for pregnancy. So, for example, if a woman is diabetic, we know that diabetes carries significant risk as early as conception, right? But if we can optimize her blood glucose control and have her coming into pregnancy well controlled, then we can bring those risks that exist throughout the pregnancy down almost to normal. Mm-hmm. So absolutely, from the beginning, once that idea comes up, that's the time to really start thinking, especially if you have underlying medical conditions. Right. Yeah.
And with that being said, I want to talk to our first neonatologist. Did I say that?
That's right.
Pronounced?
Yes, that's right.
Okay, because we've gotten to the part of conception, and now as the doctors indicated, they're higher risk pregnancies. People are getting older. We're working longer. We're saying, we'll put it off. 10 years later, we decide we're going to have a child. And now we have what we used to call preemies. I don't know if that's the exact terminology anymore. But now we have a child who may have some complications. Walk me through the specialized care that you guys offer over there.
Okay. So I work very closely with our team of general paediatricians and with my midwifery colleagues. And we look after all babies that are born at HSA. So the vast majority are born at term and need standard postnatal care. Feeding support, they may become jaundiced, need phototherapy, things like that. But about 10% of all babies that are born will require more specialist help from the team in the NICU. And in NICU, we can provide care.
Sorry, Doc. Tell them what NICU is.
NICU.
I know, but just go ahead and enlighten our listening public.
Well, the name NICU is can be swapped with SCBU. So SCBU is the special care baby unit, and NICU is the neonatal intensive care unit.
Okay.
So it's separate to maternity, but still within the environment of maternity, where babies come into our unit if they need a higher level of care. So we'll look after babies from term, for example, if they had infection or breathing difficulties. And then we also look after the whole range of preterm babies, from the very youngest to back up to term. Mm. So we can stabilise babies born as young as 24 weeks gestation now.
Wow.
Some of those babies we can continue to care for on our NICU, and others we will arrange transfer to a larger centre.
20, that's not even half of pregnancy. I'm doing the math in my head, and I'm like,
it's just over half.
Just over half.
Yes.
Wow. And you can, at that point, you can kind of kick in the gear, the complete process of ensuring.
Yes, a baby born at that gestation would need full intensive care.
Okay.
So they would be cared for in an incubator. We would take over their breathing, we'd support their blood pressure, we'd support their nutrition. So every body system we would support whilst they grow and mature.
Folks, we're going to take our first break, and then I'm going to come back and talk to our nurses, and Nurse Claire and Nurse Alicia. We're going to be back in just 2 minutes. My name is Chuck Taylor, and you're listening to Healthcare Today with the HSA. Each and every Friday and Saturday at 1 p.m., we get together and talk about all things related to your health. We'll be right back.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Welcome back to Healthcare Today with the HSA. I'm your host, Chuck Taylor. Each and every Friday and Saturday, we get together and talk about all things related to your health. We do that at 1 p.m. And today we're talking about maternity. And I want to try to say this correctly. The neonatal unit, which is better known as NICU, and did I say it wrong? NICU. Okay. Well, I have some wonderful ladies here, Nurse Claire and Nurse Alicia. Can you come on in and talk to us? Yeah. Tell us a little bit about your role with the department and what you do, and also I'll switch it to the idea of midwives and what that consists of.
Okay, so I'm Angela, and I am a neonatal nurse. I am not a midwife. Most neonatal nurses are double trained as midwives. I am not. I'm a general nurse with an additional subspecialty in neonatal intensive care.
Okay.
So for me, my general role in the NICU, I would say a NICU nurse's role is two-pronged. It's clinical, and it's also supportive. Clinical in that we provide general care for the babies in terms of providing their hygienic needs, bath, feeds, administering medications. We may also do insertion of IV lines, managing IV fluids, predominantly because most of our babies who are preterm are unable to feed orally or enterally. So most of their nutrition at the early stage is via IVs. So we have to be on the ball managing these IV lines, ensuring their nutritional uptake is paramount.
And you got to think of it this way, folks, from our listening public. You're dealing with someone who is probably less than a pound and a half, 2 pounds. So you really, any movement, any shifting, anything of that nature can be detrimental. So you really need to be, it's a constant watching situation.
It's a constant, all our babies are constantly monitored. So their breathing, their heart rate, their temperature, in their little pod, they're constantly monitored. So for us as nurses, we have to be very quick to react and intervene should one of those parameters goes off. And then unlike adults where sometimes you can see a trend in the deterioration, that's not so easy with our babies. They can just go off quickly. So a keen eye from the nursing team is usually paramount for us in our department.
That's a lot. I think of the equipment that consists of. Just I'm thinking, okay, as an adult, I've been in the hospital and I see a plethora. I'm like, wow, okay, heart, BP, and all of this stuff. For a child, that must be double full because it's such a specialized, the needles, everything that we're talking about here is on a different scale just to be operating.
It's different because, to be honest, for us in our neonatal world, most people don't know of us until they need us. They know of maternity and they'll be out on maternity and they know I'm coming in to have my baby and this is what happens.
Right.
When
there's complications.
Yeah, there's complications and they should need us. Once they walk into our room, their entire countenance changes because they've walked into a totally different world. Lots of monitors, lots of machines, lots of beeping, strange sounds, and very, very tiny people. And it's not the nurses who are tiny.
I can imagine. For a parent who has just what they went through, you ladies on that system, not just bring them to an understanding and a calmness. You probably have to walk them through because as a parent, I know at this age, every time my child goes to the doctor, I'm like, okay, what's this? It's
the same thing. It's very intimidating, and you can see it on their faces, and all their emotions are very visible. So one of the key things we have to do is to decrease that fear and lessen their anxiety once they come in. So one of the first things we do, we introduce the team. Whoever is on duty that day, we introduce the team to them, and identifying what each person on the team will be doing with regards to their baby. Once we've established, so they know this is a doctor I can ask, this is a nurse, we then walk them through the department, giving them a layout. That's where we do our milk. This is where we have our laundry. This sounds like
this sounds like a typical day.
It's a typical day. It's just getting their anxiety down. Once we do that, and they are aware of what the surrounding is, we then talk them through what is around their baby.
Okay.
What this machine is doing, and if it beeps like this, that's for us to act. If you hear this beep, don't jump. That's okay.
Right.
If you see that change, don't panic. They're going
to want to be there as much as they can. So these machines constantly making noise, clicking, moving, and they need to understand.
So we allow them to get a sense of what each beep. So every time a beep happens, they don't jump and say, oh, you sensitize them as to what beep is a critical beep.
Okay.
So once they have that awareness, the anxiety further comes down. And then we taught them about visiting and how to interact with their babies. Our department functions slightly differently because we have a 24-hour visiting for our parents. They have access to their babies for 24 hours.
Man.
So we also taught them through who our visitors are. Because our babies are so fragile, we do not have a general opening for everybody in the family to visit. It's just moms, dads, and
there's a
grandparents.
procedure that is limiting
Limited visitors.
Right. Okay.
Which sometimes they understand but don't understand. So we have to explain to them why we need to have more of a protective visiting cohort.
Yeah,
rather than the general
almost
people.
a bubble that you need to put this infant and also their circular into, right? It makes folks. You have to understand if you're listening there. It is one of these critical things that they understand that infection can come in. You're constantly out. You don't know where you're going, so they're going to be asking you questions like where you're coming from, washing your hands, things of that nature, because you're being put into literally a life situation with a child.
With a child with a very immature immune system, we must say. So anything on your hands can easily be transferred to the baby. And then because their immune system is so weak, they can become ill quite quickly.
Right.
So, when we ask parents or visitors to wash their hands, if they're having any form of respiratory illnesses, not to visit until it subsides. We are not being mean. We are not being cruel, not wanting you to see the babies. But we're acting like the guardians at this time. So, yeah.
Understandable. Very, very good. Since we've been talking about the typical daily, folks, you have to understand this is a very critical time for family. This is what I say, one of the first major humps that they have to go through in understanding, because they just came out of being traumatized by being told that their baby needs to go into this unit, this care. What does that consist of? So they need to be on that understanding. And you said that they're able to say 24 hours back and forth within reason?
Within reason, they can spend the entire day.
Okay.
We give them comfort chairs, they relax.
Okay.
They can read. Once the baby is stable enough, even if it's just a couple days old, we encourage moms to have kangaroo care. So we take them out, put them on their chest so they can feel mom's heartbeat,
bonding and things of that nature.
And then they can bond. We also teach them how to handle them while they are in their incubator or cots, changing their nappies. They can just hold their hands, play their little music. Basically what they would have been doing if the baby was inside, just that the baby is outside.
Yeah, you almost have it. It's outside care, but in a very home environment that you try to provide for them, that they have the ability to do that. Wow, awesome. You don't think of this till you hear it, because I would have never thought that this department was that intense.
People don't know of us until they need us. Right. I say that all the time.
And God forbid that they need you, but at least we know that it's there.
It's there.
And we have that ability on island because, growing up here in the past, you heard of critical care for a child, a newborn, and had to be air ambulanced out of here. And that, I just, this is, mind you, I'm telling my age, but this is back in the early days. Just think of that, the stress, the travel, just the limitations on that. And we have this great care right here on island at the HSA, which I think is awesome. Miss Alicia, if you want to chime on in and tell me a little bit about what you do and the expectations from all of the ends when it comes to care for the mother.
So I work primarily in the women's health department. So working alongside our obstetricians like Dr. Campbell, we take care of the mother from antepartum, and then we pick up back care postpartum. So as he had mentioned before, we're very involved in the teaching that he had mentioned. We provide ParentCraft Classes along with other specialties from our hospital, nutritionists, genetic counselors. We teach CPR. We provide them with videos on what to expect during labor and delivery. Say they should happen to end up having a C-section, what to expect then. Full range of teaching to encompass everything that can be expected. And that starts prenatally. They're encouraged to come. It's free of cost. So during their antenatal visits, As I said, we work alongside obstetrician. Teaching continues. They bring their questions, they bring their concerns. They're monitored throughout. If any complications are found, that's dealt with right off the bat. They've delivered safely now, whether the baby had needed to be in the NICU or baby went straight to mother afterwards. We follow up visits after they deliver. So they go home, they're discharged from hospital, they go home. We follow them up postnatally as well.
Really?
So we do home visits.
Okay.
In accordance with WHO. Mothers should have at least 3 visits in addition to their 6-week follow-up. And we do those home visits in your setting, helping you with the transition from hospital to home. Pause
and say, so I've been so far out of this game that you basically after they are released, you do at least minimum 3 follow-ups in their home location.
Yeah, so that's standard, at least 3. So 1 at least within the first week of delivery, then within the first 2 weeks, and then everybody has a 6-week follow-up, mother and baby. Within the clinic. But we do the home visits, and as before, if any issues are picked up on at home, baby's not feeding well, baby's not gaining weight, mother's vital signs are not within normal range, any issues at all, they are referred back into hospital for intervention.
Wow.
So that's done by us, yes.
That's very I would say that's very private practice. You you have to understand me coming from that old school of when you wanted that very personalized care, it was always you go to a private practice because private practice always give you that personalized care. Government entities, and I'm thinking from the U.S. because, mind you, I grew up there for many years. You would sit down and you had to wait, and this is you're really taking the service to the client, which is the mother and the child. You're really being very forthright and being there for them.
Definitely, and I will add that the service is offered to everyone who delivers at HSA. So whether you were followed up privately with your antenatal care and only had delivery done at HSA, the home visiting service is offered to everybody after you've delivered.
I'm really happy to know that our service on island has that ability to do, and not just ability that you do that, because a lot of people kind of say, okay, you know what, it's done. You're kind of on your own. And if there's something, here's my number, give me a call if there's a problem. You guys don't do that.
Our contact numbers are provided. They can call whenever.
Excellent.
24-hour service.
Yeah. We're the only hospital on island that offer the midwifery service as well, antenatally, intrapartum and postnatally. As standard for all women, regardless of their insurance.
Okay, yeah. Wow. And I was going to bring that up because, of course, we live in a day where technology kind of rules. And the fact that you guys and ladies have the ability to, within a moment's notice, be there for the mother and child at any instance, I think that's really, really great to know, because at any point in time, maybe it's your first child, maybe it's your 3rd child, 4th child, anything can happen. We just don't know.
Absolutely.
So you have the ability to just say, hey, and I heard you mention that you do CPR as well for mothers. I've never heard of that before.
Yes, our training officers do an introduction to infant CPR, which is a very good skill to have. Especially with first-time mothers, you're home with a new baby, something happens, you can intervene until emergency services get there. So, full range of teaching classes are offered.
I think that's great. Knowledge is always power, folks. If you're just tuning in, we're talking to our friends over there at the HSA, their maternity wards and the neonatal
intensive care.
Intensive care. I'm going to get it right. Our intensive care unit. And talking about I guess for me, the leaps and strides that HSA has made in the ability to deliver to the public a viable product for the community, which basically is us taking care of you. And I got to say, kudos to everyone here. We're going to take a quick break and come back. I'm going to ask the whole team to highlight a little special story, something that is dear to their heart. So we'll be back in 2 minutes. You're listening to Healthcare Today with the HSA. I'm your host, Chuck Taylor. Each and every Friday and Saturday at 1 p.m. we get together and talk about all things related to your health. We'll be back in 2 minutes.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Welcome back to Healthcare Today with HSA. I'm your host, Chuck Taylor. Each and every Friday and Saturday, we get together and talk about all things related to your health. And at this time, we're talking about taking care of the youngest of the young in our maternity. And I want to say pre, because realistically, when you talk about having a child, you really need to take in consideration, as the doctor said, the planning of it. And I wanted to ask each of the members here a little bit of something that means something to them with a storyline or maybe the department, some things that's happening in the department. Talk to us a little bit. Please introduce yourself once again.
Yeah, hi, I'm Claire. I'm one of the midwives on maternity. I am trained as a midwife. I'm not nurse midwife trained, so my expertise is in midwifery and all that entails. So our services at HSA, as midwives, we promote normality. So we are experts in low risk, and we are able to care for you antenatally during your labour and birth, and again, like Alicia has already said, postnatally. We offer a service where you have nice low risk normal care. We work really closely alongside all the obstetricians and the neonatologists, so if there's any cause for concern at all during your pregnancy or interpartum, they're on standby to give a hand if required. Many women in the Cayman Islands aren't aware of that low risk service that's provided, and it's there for all women across the board, no matter where you're from. So it's not just for Caymanian women. It's a government hospital, yes, but all women are entitled to that service, so they can come along and have a nice low risk birth. They will see a doctor throughout that time, just to make sure everything's okay. But as midwives, we're able to help you through your antenatal period and the birth of your baby without much intervention. You know, we're all about empowering the women to gain as much knowledge as they can, be informed in the choices and the things that they can do while they're pregnant and during their labour and afterwards. We provide exceptional care to ensure they have a positive birth experience, not just for the women, but for their partners and the families that are involved. Whether or not they need to have more specialist care. We work very closely with the other team members, mental health experts, physiotherapists, dietitians, and those who are expert in the chronic diseases Dr. Campbell spoke about.
I think that's really great to know, because, in this day and age, everyone kind of turns to Dr. Google and they look for answers there, when you really need to talk to a professional. You really need to come in and find the information and have a person who is as local as you can be right there and with you to walk you through it, because this is a very critical time. It's something that, it can affect on many different levels. And I wanted to bring Doctor into it, Dr. Campbell. Tell me a little bit about, something that has impacted you with this.
Yeah, apart from being an obstetrician, gynecologist, my main area of interest is dealing with very high-risk pregnancies. And I think that the thing that I enjoy the most and I've been most fulfilled about with the HSA is our ability to coordinate care. I mentioned earlier about, for example, a multidisciplinary committee. And essentially, this committee consists of persons, not just expertise in the public sector, but expertise in the private sector. We have our neonatologist, like Dr. Rob here, sitting around the table with our midwife, sitting around the table with some of the best minds on island. Our chief medical officer sits on that committee, Dr. Nick Gent, who has been a tremendous support to our department. Our chief nursing officer sits on that committee. So that allows us to have a certain ability to rapidly coordinate the care needs for patients, especially complex patients. Because, and this is something that is not necessarily available everywhere, and quite often we take it for granted.
Right.
But patients may often have to go to different providers. You need to see this doctor here, you need to see this doctor here. To deal with each aspect of their care. Imagine you having heart disease, hypertension, diabetes, and being obese in the same pregnancy. And the number of different clinic visits you'll have to have, and how difficult that's going to be to coordinate. And at the same time, the neonatologist told you, which I think was an excellent statement, that they're like a good lawyer. You only know they exist when you need them. True. But the truth is, many times our patients don't know what's happening behind the scenes. That our neonatologists are on board long before there's time for delivery. So they are part of the discussion. And I think that's something that, is already making a big difference here in the Cayman Islands, and will continue to ensure that our women here get the best care possible, not just here on the island, but in the region and the world.
Right, exactly.
So, that's something I'm particularly excited about.
And I think that's a great point, Doc, that this region, we take it for granted, but this is not the norm everywhere. It is it's the norm here for Cayman, and we're thankful for it, and we've grown to love it and expect it. But in other places in the world, this is not the norm. So we have to be thankful and in support of all that you guys do. So thank you so much in what you do. Doc, let me toss it off to you. with the idea that we talked about, specializing in equipment and things of that nature, how is that here?
We have all the equipment that we need. We have incubators, we have neonatal ventilators. Lots of our care is compassionate but also evidence-based. And recently we have gained the ability to cool babies if they have had difficult deliveries and had periods of being short of oxygen. By cooling a baby for 72 hours, we have the ability to protect their brains from further injury. And in the last 2 or 3 months, we've actually cooled our first baby here on island using a specialist cooling blanket. It's great for such a small place to be so well staffed with specialist neonatal nurses and to have the equipment that we have access to. I feel we're very fortunate indeed.
I see. I'm that techie guy. So when I hear those types of information, I'm like, okay, as a person who has had a stroke, you need to cool them down and all these other things. It's the same with a child, but now it's specialized that you can cool them down so that the brain doesn't have any more trauma to it because of heat. Wow, that's incredible.
It's a very techie place,
yes.
Niku.
I can see that. Wow, I just blowing my mind. I'm just thinking of how much ramifications that can have just locally for us, just ensuring that we have a better environment and stability for the infant. Wow, incredible. Let me switch to my nursings. So tell me a little bit about the journey here, as far as how it has grown over the time.
Okay, journey. It's a little bit different for me, varied in a sense, because before coming to Cayman, I've only been here for 3 years. Before coming to Cayman, my background and training has been in the United Kingdom.
Okay.
So we've got larger units, bigger teams, but basically at the heart of it is pretty much the same equipment. We've got the same ventilators that can manage preterm babies. We've got, as Dr. Rob says, specialized machines that can do interventions to minimize the long-term risks to our patients. So here on Ireland, it's slightly different. It's a little bit more intimate. The team is small. Experience is varied. But one of the good things about that is that we get to learn from each other. Because within this team, the nurses are from different countries. We've got persons with South African experience, persons with Indian experience, local Caymanian experience, and then you have Canadian influence, British influence. So with that, we're able to create a nice little balance of how we manage the care for our babies.
The cross-section is very good.
So everybody, the different experiences come together and really make the team and the care we give even a lot more special.
Exactly. Okay. And finally, Nurse Alicia, what you brought up you touched on the education side and the before, during, and after. Give me a little bit of that information before we wrap up here.
Okay. So for our ParentCraft classes that we offer, they're typically on a Monday. HSA is on Instagram and on Facebook, and reminders are always going out of when the class is and what topic is being covered on that particular Monday, usually from 5:30 to 7:30. As I'd mentioned before, these classes are free of cost, and they range from talks on general health in pregnancy, nutrition in pregnancy, normal labor and delivery, alternate methods of delivery encompassing C-sections, vacuum delivery, any other alternate method other than baby just coming as they typically would. Your breastfeeding, dental care, and introduction to infant CPR. So range of topics from all our experts and specialties within HSA come to these talks and give all the information. Questions are answered. And as an additional thing that's done on these days is if a mother is interested in doing a little tour of the maternity unit to see what to expect, where they will be, the layout, they are taken as long as they can be accommodated by the staff and it's not so busy.
Right.
They're taken and shown the layout. So they feel more comfortable knowing what they're coming into at the time of labor.
Exactly. Well, folks, thank you so much for stopping by here today. And I just want to say kudos to you, each of you, for what you do as service to our public. The unsung heroes is an understatement, but now I get to put names with jobs and faces and ideas. And thank you so much for being here and talking to our listening public. Thank you once again. Keep it right here as we continue on. This is Healthcare Today with HSA. I'm your host, Chuck Taylor. Each and every Friday and Saturday, we get together and talk about all things related to your health. As I say all the time, Cayman, be good to one another.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.